Hi, thank you for coming today for your training on trachs and vents. You are all student SLPs who will be joining us here at our hospital. We see a lot of patients with trachs and vents, so and I know you probably have learned about them in class, but we just want to give you a brief overview of them again, since that is a lot of what you will see here in our hospital. There are many diseases that affect the respiratory system. A lot of our patients here may have ALS, MS, or have suffered from a CVA. There are many different things that can affect the respiratory system and then cause a person to need intubation and a trach put in. So it's very important for you to check the patient's chart first, because all of this information is very important when you're dealing with a patient. So anytime you go into a new patient's room, please make sure you do a very in-depth chart review to make sure you know what's going on with this patient before you enter their room. There's many purposes that our trachs are put into patients. They help provide adequate ventilation and oxygenation. They also eliminate airway obstruction, and they reduce the potential for aspiration, and they help provide access to the airway lungs for pulmonary toilet. So the airway management can include the endotracheal intubation. So for this, the tube is inserted orally and nasally through the vocal cords. The tube typically has a cuff on the end that inflates to the tracheal wall. So you can inflate and deflate that cuff. That is a very important part of treating a patient with a trach tube, to know if the cuff is inflated or deflated and when it needs to be deflated before you see the patient. The endotracheal tube is inserted via a laryngoscope. But there are many potential complications when we deal with this with patients. We need to make sure there isn't damage to the oral cavity. There could be damage to the vocal folds. You could also encounter aspiration during placement of the tube. You could also find granulomas. Tracheal stenosis could be very difficult, because with the narrowing of the trachea, it could be very difficult to get the trach down to the patient's throat. You can also have tracheal trauma. So the airway management includes the tracheotomy if it's a long-term artificial airway required for each patient. An indication for this would be an airway obstruction, like a mass or oral pharyngeal swelling. Also, poor secretion management and prolonged mechanical ventilation are all reasons that a patient may need a trach. So it's important to know the terminology when dealing with patients with a trach. A tracheotomy refers to the surgical procedure that a patient undergoes to put in a trach. A tracheostomy refers to the opening in the trachea, called the stoma. Tracheotomy placement can be done in the OR or at bedside for an ICU patient. If you don't have the time to get them into the OR and it's very critical that they need it right this second, they can do them in the bedside. This is done by a skilled doctor, and the incision is made around the second and third tracheal rings, and then the tracheostomy tube is placed. It's very important that you don't confuse this with a laryngectomy patient. It can be very confusing, but you all have had classes before, and so you should know the difference between them. So next, in our next portion of your training today, you will be learning about the different brands and types of trachs that you will see in this hospital. Some are made of metal, some are disposable, and some non-disposable. Your next training will go into depth about this part, about that. There are different parts of the trachs, that's what we will talk about now. You have the outer cannula, the hub, which is about 15 millimeters, the inner cannula, the obturator, the flange, the cuff, which we have already discussed, that comes with the pilot balloon and the pilot line, and that is where you deflate and inflate the cuff, and then it also has a button and a plug. The sizing is now what we will talk about at the trachs. They are typically referred to in millimeters. The size varies. It can range from 3 millimeters to 10 millimeters. And the sizing varies by manufacturer. So it's very important to remember that not all size 6 trachs are the same, as different companies' sizing may be a little different with their trachs. You can use the inner cannula or the outer cannula diameter to give size. And there are many different charts available comparing the sizes ranges and the sizes of the different company brands. So if you ever need that, those are very helpful resources that you can use. So thank you for this. My partner will come up next and talk about the different trach types and to give you more information about that. Thank you.